Thank you so much. I'm so proud to be here this morning on behalf of the Ad Council and really to follow all of the inspirational panelists and conversations we've had this morning. And also, I don't know where Priscilla went, if she went to take off her microphone, but just really to applaud her bravery and Amalgamated's bravery and really putting action behind their words. Because I think, like she said, this cross-sector group of people in this room and everyone playing their part is just really special. So at the Ad Council, we are privileged to be here. For more than 80 years, the Ad Council has built social impact campaigns addressing the most urgent issues in our country. And over the last few years, we have been building a big tent to address gun violence prevention, addressing secure firearm storage through our End Family Fire campaign, raising awareness on extreme risk laws through Pause to Heal with our partners at Brady, at Joyce Foundation, IPDH, and many others who are here today. And thanks to many of you in this room and online, your tireless work in tackling all forms of gun violence, there is hope to be found. I know someone talked about hope this morning, I think Michael Dowling, and I think that's a really important piece that we want to keep in this today. In recent years, gun violence prevention organizations have been working so hard to center safety as essential to safer communities by passing the most significant federal gun safety law in nearly 30 years and successfully strengthening state laws across the country, which we know are going to be critical in the years ahead. The CVI field has been working tirelessly on the ground in our communities, disrupting cycles of violence and increasing public safety. And our friends in the hospital and healthcare community and their leaders working together as the National CEO Council have been working tirelessly to implement life-saving programs in hospitals and reframe gun violence as the public health issue that it is. This ecosystem involving all of you and so many others has contributed to the historic decline in gun violence that we're seeing in the last few years. And as a mom and as part of the Ad Council, I want to say thank you. Now, we know the issue of gun violence in America is extremely complex. Homicides are most intensely felt in Black and brown communities, suicides in white communities. Since Columbine, nearly 400,000 students have experienced gun violence at school, and 8 kids a day are injured or killed by unintentional shootings. So as we look ahead, we know that no one group or entity can solve this problem alone. That's why we at the Ad Council are grateful and honestly just humbled to play a small role in this multifaceted fight. By joining forces with the leaders in this space and so many others, we are in a unique position to leverage our communications expertise and our history of creating narrative change to amplify and to accelerate all of the great work and all of the success that's already happening. As Dr. Bettinelli said, exactly 1 year ago today at this forum, we announced our gun violence prevention initiative. Building on our past efforts, this initiative involves multiple campaigns, each designed to impact specific audiences, all to bend the curve on gun violence. And we're thrilled to debut the first phase of our work today. But first, I wanted to share a few insights that led us here as we've been talking about agreements this morning to ground us in the data. According to data from the Ad Council Research Institute, 80% of Americans in households with gun owners agree that practicing safe gun storage would reduce gun violence. 82% of Americans agree with temporarily restricting gun access to anyone at high risk of harming themselves or others. And according to a 2024 Ad Council Bully Pulpit International Survey, 8 in 10 Americans agree that having more productive conversations can reduce gun injury and death among children and teens. In other words, when it comes to gun violence, Americans actually do agree on far more than we disagree on. We don't have to agree on everything. We are never going to. That isn't even the ask. But we all know that when we say agree to disagree, we are ending a conversation. But what if we can say agree to agree? Suddenly, we've started a conversation. Let's take a look.
I do not have guns at home.
Yeah, we have a shotgun at the house.
I've been shooting since I was a kid.
I would never have a gun in my house, and there's more potential for people that I love to be harmed.
As a single mom, I feel really safe and secure having a gun in the house.
Every day when I drop my daughter off at school, the thought of my daughter not coming home
We disagree on a lot of different things, my wife and I. Guns don't kill people, people kill people.
Family, friends, teachers, and alumni, welcome to our debate. The motion for today is, who holds the biggest responsibility when it comes to solving the gun violence crisis?
Currently, guns are promoted as symbols of power, glory, and excitement, rather than the dangerous weapons they are. Communities must step up and protect against this normalization. Doctors, social workers, and teachers are all responsible for keeping us safe and healthy, because the root of the solution lies in collective action.
Laws alone cannot stop a bullet. It's up to individuals to take action. They have to make sure their guns are stored securely and out of reach of kids or those at risk of suicide.
Well, communal education addresses this individual action issue as well. We can teach kids about the dangers and about the misuse of guns.
I don't think you realize that my opponent is blatantly stating arguments that have no evidence to back them.
If you're blaming me for having no evidence, I haven't seen you bring up any statistics.
Judge, think about it. Do we really want to blame all of this on the community, our friends, our doctors, and our teachers? No.
Well, I completely disagree.
I'm not going to listen to points that are completely ridiculous.
Point of inquiry. Do you guys even realize that the #1 killer of children and teens are gun injuries?
And it's not just mass shootings. It's homicides, unintentional injuries, and suicide.
Why are we fighting about this?
With so many people stuck in their views, we're not talking about it altogether.
Is figuring out who to blame really solving the problem at hand?
We must set aside our differences and embrace open conversations with everyone.
You're probably starting to realize now, this is not a debate.
This is a message to you all to start a conversation right now. We yield our time.
It's really a social issue that we should be able to address as a country.
There is no adult in this earth that wants children to die.
We need to stop fighting about who's right and wrong and start focusing on the health and safety of our children.
It's a wake-up call for adults to be adults.
I hope that we come together to find a real resolution that works for everyone.
I worry for my kids.
And these were not actors in the film that you saw today. These were real kids that came in to debate this issue, and real parents and real responses. And as I think everyone in this room would agree, we can all agree that no one deserves to lose their life to gun violence. And we can all agree that it is absolutely outrageous that the #1 killer of children and teens in this country is gun injuries. We all want solutions. We all want our loved we all want our loved ones and our communities to be safe, period. That's why we know that Agree to Agree is going to be such a powerful new platform. This campaign started with a conversation with our wonderful partner and Ad Council board member, Ramon Soto, and CEO Michael Dowling at Northwell. Ramon said that it was going to take 1,000 acts, large and small, to curb this epidemic and protect children and teens, and I have seen exactly what he means. That one conversation has led to more conversations with many of you, with funders, with partners, with researchers, and our coalition has begun to grow. The ideas have begun to come together, and the individual acts of good are growing into something larger as the creative comes to life. And the impact will ripple out. A parent asks another parent if guns are stored securely before their child comes over to play. A loved one works to temporarily separate a person in crisis from their firearm while they get the help they need. A community-based group can prevent an act of violence. An emergency responder gets connected with the critical resources they need to take care of themselves so they can continue taking care of others. And our doctors and nurses get the support they need. A life is saved, and another, and then another. I couldn't stand up today without acknowledging the incredible people and organizations who have helped partner, fund, advise, and make this program possible. I would just ask if you could just stand up for a moment so that we can thank you officially. Thank you all so much. Also to our partner at Gut Miami, our creative partner who worked pro bono on this campaign. Because of all of you and your generous support, we will help save lives and protect our loved ones from firearm injuries. Today's launch is just the beginning of this massive effort. We are committed to more messages for parents, for the healthcare community, and working very closely with the CVI community to use the power of storytelling to shine a light on the impact of their work, so that the public can truly better understand the important role that CVI plays in increasing public safety. This work is in its very early stages and will come to life early next year. But we need more partners to join us, more funding to accelerate impact, and more voices to share their stories, more trusted messengers to amplify the campaign, and more places to run media. So if you're asking yourself what you can do, please go to agreetoagree.org, where you can find our PSAs, conversation guides, social graphics, and language to be able to support the campaign and join the movement, or better yet, find me or any of the Ad Council team who will be here all day. We'd love for you to join us. Now I would like to invite Dr. Jose Prince and Dr. Mason Turner to the stage for our next panel. While they make their way up, we're going to watch a piece from Dr. Lachey Ajayi, an experienced community pediatrician, adult and pediatric palliative medicine physician and clinical researcher based in California. She believes it is part of her role as preventive care provider to talk with families about firearm injury prevention, just as she does when screening for risk of dangers in the home, like water temperature and pool safety. So now we can watch that film.
Hi. Hi. In pediatrics, talking about firearms and safe storage, things like that, it's just part of the medicine that we give. It's not about judging you or trying to change your lifestyle. It's about how do we partner with you so that your family has the best outcome and everybody is safe and healthy and growing really well.
At school, are you able to draw an X?
Back in the early 2000s, motor vehicle crashes used to be the #1 cause of death in children and teens. And there was this huge advocacy campaign around that.
And are you still in a booster seat when you ride?
We did a really good job about decreasing the rate of death caused by motor vehicle crashes. We can do the same around firearm injury prevention. So when I'm talking to new parents, I'll talk about smoking in the house. I'll talk about water temperature. I'll ask, are there any firearms in the house? When your baby goes home, how do we make sure they're safe? And I want to make sure that it's not about me coming in and telling them what to do. Somebody has told me, yes, I have firearms in my home. It is a safety I use to protect my family. And I will say, great, I'm also here to protect your family, to make sure that your family stays safe. Can you tell me about where your firearm is located? I ask questions. Oh, can you tell me more about that? How do you store your firearm? That way, I can actually provide advice that's relevant to their lives and their homes, and it makes them feel safe and, again, heard. No one thinks it's going to happen to them. No one wants it to happen to them. It is part of our duty to give this good news so that they can be part of the solution to prevent firearm-related injuries. Having this guidance is so important and is so much easier than giving bad news. It is so much easier than having to do trauma counseling and dealing with the aftermath. Let's not put ourselves in a position to have to break bad news. Let's put ourselves in that position where we can have a conversation with our patients about how they can stay healthy and well. Let's agree to agree that we can all make a difference.
Great. Well, I'd like to welcome you guys to the stage. I know we had a chance, Jose, for you to introduce yourself before, but would love Dr. Turner to do a quick introduction before we get into the conversation.
Sure. So I'm Mason Turner. I'm a psychiatrist and addiction medicine physician. and the Enterprise Senior Medical Director for Behavioral Health for Intermountain Health.
Perfect. So we're going to spend a few minutes just talking a little bit more deeply about why healthcare and really the role that healthcare plays in this important conversation in trying to help protect our kids. And Dr. Prince, we shared, your powerful video earlier today, really focusing on your role as a pediatric surgeon. But I would love to talk a little bit more deeply about the other hat that you wear in helping to head up the Gun Violence Prevention Center for Northwell and why that's so important to you and such an important part of the work that you do and your role as a trusted messenger in this fight.
Yeah, thank you for the partnership, for the great work that's been done and that's going to be coming down the line. Thank you for joining us. I think the privilege of being the executive sponsor and helping to support the gun center violence prevention center that Northwell has developed. I brought the water up. I've been doing a lot of talking.
I know. It's a little dry in here.
It's really bringing together all of the resources. And I guess for me, what I would say is it's been an opportunity to step outside of a 70-degree fluorescent sterile operating room where things are very organized and very clean, and to go out into where really the messiness of life is and happens. And how do you then harness the larger organization and all of our team members to bring that work forward? And I think that the power of what drew me to surgery was the power of operating on that one child. The power of what we do as a collective is to expand beyond that reach of what you can only do with one set of hands at one time. And so it's been a tremendous privilege to be a part of this and to be a part of the Northwell Center for Gun Violence Prevention that Dr. Sathya leads for us and has done such a great job. You'll see Che a little bit. I know everybody here knows him already.
Everyone knows him. And I know we talked a little bit last night about, the conversation side of this and the personal side of doing this work and being on the front line with parents and families and helping them get through these horrific tragedies and how that wasn't something that necessarily you learned in medical school, that it was almost quite the contrary. We just talk a little bit about some of that work and the way that empathy and the personal side of this for you.
Yeah, when you're trained as a surgeon, there's a little bit of and it's true for the field of surgery, there's a military component almost to it, where you, and especially early on, where you're just so busy, you move from one patient to the next, and I think I made the comment that healthcare Captain Sully landed a plane in the Hudson and nobody then picked him up and said, actually the 4:30 flight needs to take off. Can you, you seem to be free now. But that's what we do, and I have vivid memories of, especially in that training phase, of having a body bag wheeled away as I was then starting the next patient's care. And so how do you do that, right? And so part of that is locking it away. As the years go by, and I think locking it away doesn't really then help bring voice to the reality that we see. And I think that's why healthcare has a space. Nobody, I hope, nobody really should ever have to see some of what we see. But we're the only ones who can speak to that part of it. That is our lane, as our colleagues around the country have brought forward. And I'll just add quickly, there's the personal part that's not the professional part. I have family members who have died from gun suicide. I have a big family, cousins who've gone to prison because of the use of a firearm, which made the sentence even greater. I have a son who's at school in a make-pretend bubble in the south side of Chicago. I've had my middle son come in as mocked up for a mass shooting event that we drill at the Children's Hospital. So think about the irony and the weirdness, seeing your own son sort of portrayed that way, but not really. And my daughter started school this year with 3 days in a row with snipers and police on the roof because of swatting. It's just not a normal way to be. And just doing the work in the operating room isn't enough. And just doing the work of healthcare in our lane, only in a hospital, is not enough. And I think that's the message we're hoping that you all continue to help us to push forward and push out there.
Yeah, thank you for that. And Dr. Turner, for you, we know that sadly the toll gun violence takes on youth in this country is not only physical, and that so many of our kids have been exposed to gun violence studies are clear that there's, increased anxiety, depression, PTSD, other impacts. And we know that's true for those that have witnessed gun violence, people that are healing from gun violence, survivors. We truly are in a convergence of crises in this country as it pertains to mental health and gun violence. Can you talk a little bit about your role, what you see there, and the role that the field can play in helping the country combat these converging crises?
Yeah, I think everyone in this room knows that being a kid, being a youth, being an adolescent is really difficult these days. And we can probably argue it's probably one of the most difficult times to be a child or an adolescent in history to a certain degree in terms of the mental health burden that kids are carrying these days. And when I think about gun violence prevention, we can think about it in a couple of different ways. First of all, we want to prevent the gun violence, unintentional injuries, suicides, and so forth. But I want you to think about for a minute that our kids that are exposed to gun violence, whether it's in their families or whether it's at school, whether it's their friends, those have lasting consequences possibly throughout their entire lives. And so part of the work that we're really trying to look at how we actually intervene when there's been a traumatic event quickly, systematically, into every single person that is affected by violence, potentially can develop post-traumatic stress disorder. Because there is disparity in how gun violence affects our communities, we have to also think about how our mental health care and behavioral health care meets those disparities and considers those. So when we create a system of care that we want to treat violence, we want to screen for it, we want to treat PTSD, other conditions, we've got to think about those racial, socioeconomic, and other disparities that come into that conversation as well.
Yeah, and we talked, you saw in the film, so much of what we're doing with our campaign is really trying to lean into the common ground that we do have and to get people to talk more and just to start these conversations, whether they're in the medical setting, it's, parents to parents or in communities, and really to change the social norm and sort of bring this conversation out to do our part in playing this. Can you talk a little bit about just the role of conversation and where that fits into making our way through this crisis?
It's super important that I think whenever we're working with kids in any setting, whether it's in the emergency room, in the outpatient clinics, wherever they show up and we're actually having a conversation, to understand where that family system is supporting and how they're not supporting the kid as well. How we can actually talk with the parents and say, have you thought about things a little bit differently? Maybe you need to think about those firearms at home and how you're considering, are they locked? Both for the benefit of your own kids, but also others that come over. But the conversation is really important. And as a physician, I was trained at a time where we were basically told that we had the expertise, we knew what we were doing, we were going to recommend a treatment course to our patients. That no longer works, and I'm not sure it ever really worked. We have to have a conversation, understand the perspective of the person sitting across from us, the parents, the kid, and tailor our recommendations with our team to what that individual family and child needs.
Excellent. And, just to wrap it up, I think, because I think we're probably a little late on time, so I'm going to be generous and give some back for other people. As we're launching this campaign, and, we know that we all can agree that guns should not be the number one killer of children and teens in our country. What gives you hope about this approach of this collaborative, cross-sector room of people and online in this field working together, trying to really, you heard a lot today, everyone who's been on the stage has talked about agreements and common ground and the things that we really can do on behalf of our kids. What gives you the most hope in the work that you do moving forward?
What gives me hope is that there's a room here of people that are interested in this topic. There are a lot of people online as well, really rowing in the same direction and wanting the same thing for our youth and our families and our communities moving forward. And together we can accomplish a lot, as long as we agree to agree.
My hope is sitting right in front of me in Nazir, right? My hope is in our next generation. That, in the world that I grew up in, with a Cuban father with a cigar, smoking was so prevalent. That is not the world we're in. And I grew up not wearing a seatbelt in a car, as Mr. Dowling often points out. We can change things that are complicated. And when we listen to the voice of the young people and hear what they're asking us to do, and we can agree to work together with them and for all of our benefit, that's what gives me hope. It's the next generation.
All right. Well, thank you both. And we're honored to be here and do this work with you all. And that's what gives me hope. So great to have you.
Thank you.